Chiropractic, and today's joint-by-joint approach, we will cover the knee. For a knee assessment, I'm going to have Nicole lay on her back. I'm going to be checking out her left knee, but I would compare with the right knee just to see if there's any discrepancies between the two. I'm going to look at her ability to flex her knee, or me passively flex her knee. If there's any limitation or clicking or clunking, we could assume that there might be something going on in the joint. I'll look at extension, which is a very small movement, but you can feel if there's a difference between the two. Sometimes with joint issues, terminal knee extension is stiff and painful. So I'd be asking her as I'm assessing if there's any pain with either of these movements of the knee. I'd also look at resisted testing, so I'd have her on her stomach for that. And for this, we're looking to see if there's any pain when she's contracting the musculature. So for the hamstring, I would have her bend her at the knee and keep going all the way and see if there's any target zone or issue in the hamstring as she's bending the knee. I'll have her do it again just to test. Once again, I'd test in comparison to the normal knee. And then I would test the quadricep by having her resist or push down into me. Good. And I'd be asking if there's any pain. If there's any pain with resisted testing, that could be indicative of muscular tendon type of issue. We could also look at different type of orthopedic tests. So I could have her sit up. Actually, let's have you stand up. Joint conditions, sometimes with compression on the joint, could be painful. So if there's any type of meniscal injury or tear, that could be painful. So I'd have her stand on one leg and kind of do a squat and come back up and ask if there's any pain. Sometimes with compressing a joint through squatting, there can be an increase in symptoms. So we're going to gather a history of the patient's complaint. If there's an injury, we're obviously going to screen with x-ray or diagnostics. But with our assessment and historical information, we can kind of guide the treatment or determine what the patient comes into the office with. Thank you.
Thank you.